Hello, I'm Dr. Frances Pitsillis. Did you know that up to 100% of people can get acne at some stage in their life? Well, it's called Acne Vulgaris, its real name, and that's because it looks awful. And it tends to affect two main groups of people. I'm going to separate it out into normal teenage acne and generally women separately, and often a little bit older. Now, in teenagers, we sort of expect everyone to have a bit of acne and we think it's part of normal teenage life. But what's interesting is that when you see the Asian teenagers, the ones that have got acne are more likely eating a Western diet, and the ones with clear skin are eating a traditional Asian diet. So we know that part of the problem is going to be the sugar and the starch in the diet. You see, the sugar and the starch tends to increase the inflammation in those young people's skins at that age, and that is part of the problem. As well as that, we have increased sebaceous secretions from the glands, and we can have a bacteria called Propionibacterium acne, but it's often a conglomeration of all of these things that are happening in a young person's skin that makes them more prone to acne. Well, the treatment of a young person's acne is to try and sort out their diet if you can, put them on fish oil, correct their zinc imbalance, give them vitamin C, because all of those things help the skin. Apart from that, there are lotions and potions that you can put on, including creams that are derived from vitamin A, and then we've got oral antibiotics. If we really have to, we can go to stronger drug treatments because we don't want that person to scar. When it comes to other groups with acne, what comes to mind for me quite a lot are the younger women who are still getting acne in their 20s, and these women often are also a little bit hairy and sometimes a bit overweight, and they have a condition called polycystic ovarian syndrome. And this is where the ovaries tend to make excessive androgens or male-type hormones. The first thing that doctors often do to help these young women is to put them on the contraceptive pill because it blocks these male androgens which cause more acne for them. But if you wanted to take a more natural approach, you would do the same things as you would for a teenager, and you'd get the sugar and starch down in their diet, because definitely the overweight polycystic ovarian syndrome patients may have a tendency to insulin resistance. That's where the body is resistant to the action of insulin in helping glucose get into the cell. And these same young women have a high risk of developing diabetes later on and having infertility. So in addition to the younger women with polycystic ovarian syndrome, we have the older women who start to get acne for the first time, perhaps in their 40s, sometimes earlier, and they feel it's quite odd, really. And what often can come along with it is that they tend to get more premenstrual symptoms and heavier, more painful periods. Now, I think in this case we can zone it right down to lack of progesterone in the second half of the cycle. And we call that estrogen dominance because instead of progesterone dominating the second half of the cycle, estrogen now is a bit more predominant because progesterone's dropped further. These women are often approaching menopause, but if women are quite stressed, then they will get this problem as early as mid-30s. And this problem is treated by correcting the hormone imbalance and giving them micronized progesterone, which is the safe progesterone. But very often we're going to look at zinc and we're going to look at fish oil as well. And in addition to all of this, we can use laser and light therapies. We can use intense pulsed light, and we can use the deeper laser, the 1064 nanometer laser, which is painless, and we can also use a blue light, because blue light kills Propionibacterium acne in teenagers. So as you can see, acne is not just something that teenagers get and that can be simply treated. It's something where you need to think about who is that person that has acne and what age group are they and what else is going on. So therefore, what is the appropriate treatment?